Welcome to the whiteboard video of the axial spondyloarthritis working group. In the next 5 minutes, we will present an overview of the proposed domains to update the ASAS-OMERACT core domain set for ankylosing spondylitis. The original core set was developed in 1999 by the Assessment of Spondyloarthritis International Society, known as ASAS, in collaboration with OMERACT. This core set has been well implemented in clinical trials, but 2 decades later, ASAS considered it necessary to update the original core set. The periodical review of a core set is important to ensure that the outcomes are still relevant and to allow adding of new outcomes. The Axial Spondyloarthritis Working Group was formed in 2018, bringing together 28 stakeholders from around the world, representing patient research partners, rheumatologists, health professionals, researchers, pharmaceutical companies, and drug regulatory agencies. In January 2020, the proposal of the working group for the OMERACT Onion, including the mandatory and optional domains, was voted on and accepted by the ASAS community at its annual workshop. Hereby, the working group is asking for OMERACT endorsement for this proposal. This is following an identical process as was done for the original core set. This video will briefly describe how we got to this point. Why update this core set? The current ASAS-OMERACT core set for ankylosing spondylitis was a milestone. However, this core set exists for about 20 years with only very minor adaptations during this long period, while major advances in the field as well as in the methodology to develop core sets have occurred. Since the development of the original core set, it has become apparent that axial spondyloarthritis consists of 2 subtypes: radiographic axial spondyloarthritis, also known as ankylosing spondylitis, and non-radiographic axial spondyloarthritis. The combination of these factors made ASAS decide it was time to update the core set, including both subtypes of axial spondyloarthritis. Our mission is to identify the domains that all stakeholders deem most important and should therefore be measured in all trials investigating interventions in axial spondyloarthritis. We will take you through the steps we have taken to get to the proposed domains. Same as for the original core sets, 2 different settings were defined to update the core set. On the one hand, we have trials investigating treatments that may change the course of the disease, referred to as disease-modifying treatments, and on the other hand, studies focusing on relief of signs and symptoms, referred to as symptom-modifying treatments. Up front, it was decided if one domain was selected for the symptom modification setting, it should also be included in the disease modification setting. In order to identify all possible candidate domains for the core set, 3 different sources were employed. The first was a systematic literature review of all studies evaluating pharmacological and non-pharmacological interventions in axial spondyloarthritis. Secondly, we included information collected on the qualitative studies and patient focus group interviews that took place to develop the ASAS World Health Organization comprehensive and brief core sets of the International Classification of Functioning, Disability and Health for ankylosing spondylitis. All aspects of health identified in this process were considered when defining potential domains. The final source of potential domains was the open question of the first round of the Delphi survey, in which participants could suggest additional domains of interest. These 3 sources resulted in a list of 42 potential domains, which were then clustered and labeled, and after discussion with the steering committee condensed to 13 potential domains. Then a 3-round Delphi survey was employed to get patients and axial spondyloarthritis experts around the world involved in selecting the domains that should become part of the core set for axial spondyloarthritis. 188 patients and an identical number of spondyloarthritis experts were invited to partake. The patients came from the United Kingdom, Canada, and the United States, and were invited through their respective national patient societies. The spondyloarthritis experts were all ASAS members and other stakeholders in the working group who represented 45 countries in 6 continents. Following OMERACT guidelines, a specific domain was included if at least 70% from both patients and spondyloarthritis experts selected that domain. In addition, it was decided upfront that unless there was a good reason to exclude the domains that were part of the original core domain set, they should also be included within the update. This has resulted in the following proposal for the OMERACT Onion. 7 domains are mandatory for all trials on an intervention for axial spondyloarthritis. These are disease activity, pain, morning stiffness, fatigue, overall functioning and health, physical functioning, and finally, the general domains included in every core set of domains, namely adverse events and death. On top of these, 3 additional domains are considered mandatory for studies investigating disease-modifying treatments. These are extramusculoskeletal manifestations, peripheral manifestations, and structural damage. The domains sleep, spinal mobility, and work and employment were considered important but optional. We hope you agree with the proposed domains and will endorse this core domain set for axial spondyloarthritis. On behalf of the Axial Spondyloarthritis Working Group, we thank you for your engagement in this process and we greatly appreciate your vote.